everyone, welcome back to my channel Tiny Talkers. My name is Brenda if you're new here, and I'm a speech language pathologist. In this video, I'm going to tell you exactly what a speech language pathologist is. A speech language pathologist, aka a speech therapist, a speech pathologist, a SLP, never a speech teacher, is a professional who assesses, diagnoses, and treats disorders that have to do with speech, language, social, cognition, and swallowing. Just to quickly sum up what exactly these disorders are. So if it's a speech disorder, it means there's an error in sound. For example, a child who cannot produce the R or can't produce the L. So if it's a language disorder, the client has difficulty maybe understanding or speaking language. For example, maybe the client has difficulty with pronouns or verbs. Then we have social disorders. This means that the client is having difficulty with the social use of language, like the social rules, maybe with greetings or making the proper eye contact. Then we have difficulty with cognitive communication. This means that the client has difficulty with thought organization, planning, and problem solving. Usually we see this in TBI patients. Then we have swallowing disorders. This means any difficulty with feeding and swallowing. Speech pathologists can work in a variety of settings. We can work in home health, clinics, private clinics, hospitals, schools, education, research, nursing homes, and we work closely with other professionals like audiologists, OTs, PTs, teachers, doctors. Speech language pathologists can work with clients of all ages, from newborns, maybe working on swallowing and feeding, all the way to geriatric with maybe TBI and stroke patients. We commonly see patients with autism, ADD, ADHD, TBI patients, stroke, and the deaf community.
Alright, same sweater, different day. But as I was editing this video, I realized that there was a few things that I left out that I wanted to say. So in the process where someone has a concern in any of these areas, they can come see a speech pathologist. And basically what happens is the speech language pathologist assesses them using a standardized test. So they will be assessed for their language or memory or whatever it is that they have a concern with. So once the SLP assesses the patient with this test, the patient is given some sort of score. So this score will qualify them or not qualify them for services. Depending on the score, they will come more often than not to therapy, maybe once a week or 3 times a week. Using this assessment, the SLP will create goals and will create what we call a plan of care. So every week when the patient comes to therapy, the SLP will target the goals on this plan of care.
If you're interested in becoming an SLP, I highly recommend that you visit ASHA.org. That's our national association. Well, if you enjoyed this video, give it a big thumbs up, subscribe to my channel, and find me on IG, and I'll talk to y'all next week.